Can you see my?
All right, letting everyone in. Well, good afternoon, everyone. This is Terry Kennedy, and I'd like to welcome you to our final session in the value-based care, the Medicaid value-based care learning forum series. Today's topic is closing gaps in care. And again, we have our presenter, Heidi Robertson Cooper, which you all should be familiar with at this point. And I'm going to hand it over to Heidi.
Thank you, Terry. Good afternoon, everyone. As Terry had mentioned, I'm Heidi Robertson Cooper, and I've been with you along this series on supporting value-based care in your health centers for Medicaid in particular. And so today we are wrapping up the series, and we're going to be talking about gaps in care. Because as you all know, this is an area that you're hearing about constantly from the managed care organizations. If you're participating in a Medicare ACO, you're hearing about it there. And then if you're also thinking about just population health and implementing that within your health center, that's something you're thinking about. So I'm hopeful that this session you'll take away some concrete examples and different strategies that you can implement in your health center, or at least to give you some information to kind of mull over with your teams. So let's jump right in. So as I said, this is kind of our wrapping up our session. We've done a lot in this series. Maria started us off with really looking at ECW and enabling that for value-based care for those health centers that use ECW. We went pretty deep into CanCare and the MCOs and their pay-for-performance programs that they were offering to health centers, and really kind of breaking down those agreements, what benchmarks look like, what incentives look like, and how to kind of optimize your health center and thinking about your strategy and being as focused when there are so many things to look at from an attention standpoint within those agreements. We also spoke with a lot of your finance teams regarding financial performance and supporting your teams and how to maximize ROI, but also knowing that staff and workflow and different technologies are all constraints that health centers are facing on a daily basis, let alone in a value-based care-oriented framework. And then we've also spent a little bit of time on data. And so today we are shifting towards care gaps. So we're going to look at first, we're going to kind of define care gaps and what those are. We're also going to look at different barriers, which I'm sure you all could write a dissertation on, knowing your roles in health centers and the work that you're doing already. And then we're also going to lean into some strategies and kind of a framework to help you think about how you want to approach this, or how you can maybe take a fresh look at what you're doing in your health centers regarding care gap closure. And then last, I'm going to share an example of a health center that I've worked with that has spent a lot of time revamping this process. And then we want to hear from you all, because we know that you're doing great work in this area. And so we also want to hear what's been happening at your health centers, different barriers or different things that have worked. And so we'll be asking for you all to share that as we go along. So if you have questions, feel free to put it in the chat, raise your hand. I am A-okay with taking questions as we kind of move through the slides. So with that, let's jump right in. So I don't want to assume that everyone knows why care gaps are something that we're talking about. But I think that from a value-based care standpoint, there are a lot of things that are pointing to closing care gaps and understanding care gaps as really a strategic priority for health centers and primary care overall. But from a population health standpoint, thinking about your population and the care that they need in a proactive way is really foundational to how health centers and primary care practices are asking to be or asking and being required to operate in this environment. We also know that when you are working on UDS, which it is that time of year, as you all know, the quality reporting really does kind of signify how well for your patient population that you've seen, how you are filling those gaps and how many opportunities your health center has in supporting patients and ensuring that those care gaps are closed. So we are looking at it from an operating model to an accountability standpoint from HRSA and UDS. For those of you that are recognized as a patient-centered medical home, you know that proactive planned care is a key cornerstone to PCMH recognition. And we also know that the MCOs are constantly telling us about our patient population and how many care gaps are open, and how many patients need to be seen for care to have those particular care opportunities addressed. So health centers are really feeling it at various different angles. And so, as we, have discussed in previous sessions, this is really an area that your health center is likely spending time on. But the goal today is to give you some additional perspective and maybe insight into what you're already doing, and if prioritizing care gap strategies is not something that your health center has really spent a lot of time on due to various different issues. I'm hopeful that today you will have some information to take back to your health center to help kind of elevate this particular issue. So let's define what a care gap is. I think traditionally we think about a patient who needs a certain cancer screening or preventative care if they haven't received that in a particular time frame, either outlined by evidence-based guidelines or by a specific quality measure specification. We typically think about that as a care gap. So a lot of this is pushed by payers, and you will remember this is kind of a Medicaid MCO oriented session. We also know that our uninsured patients have care gaps too. And that's something that you obviously are working on from a population health standpoint. But when we think about care gaps, yes, it is care that a patient has not received due to various different factors. And so I kind of want to break those down into three different areas. So one is service delivery gaps. So think of this as, your flow of a patient visit. This could be related to workflow and not having information available before the patient comes in to identify whether or not they've had a well child visit or a cervical cancer screening. And when they are there at the visit, that gap is not closed. And that's likely due to not having the information or the workflow set up within your particular health center to help address that gap when that patient is there right in front of you. Second is what I'd like to think of like as service engagement gaps. So we see this a lot, and you all know this very well, where you have attributed members who you've received a roster from an MCO and they do not have a relationship with you, but it is your health center's kind of responsibility to help get that patient in for a visit and help resolve that care gap. That patient isn't engaged in your health center. You don't have a relationship with them yet. And so that makes it really hard to engage them in primary care and to close that gap. Additionally, we see this where there are patients that are necessarily not understanding of why they need a particular screening or need to come in for a visit to help address certain chronic conditions. And so there's the patient aspect or a cultural aspect of not understanding the importance of that. And then you all understand the demands on your schedule and access. Patient access is always going to be an issue. And then last is, I call them like data gaps. And so this is essentially the documentation issue. So you've seen the patient, you have conducted the screening, but the EHR does not reflect in the appropriate way that care gap was closed. And so the work was done, it's just not documented in a way in the EHR, or is not translated over to a claim where the payer understands that that care gap has been resolved. So that's kind of an orientation to how we're thinking about care gaps today. But essentially, it is care that is supposed to be rendered based on either clinical guidelines or related to a specific quality measure. And there are different ways that impact why that gap happens. This next slide gets to the barriers. So again, I think each one of you can talk about this in depth, but I like to think of them in two different ways. One is systemic. So think about your health center, as a system. And so your system needs to enable the right people, technology, and workflow in order to really address some of these particular issues. And so I have pointed out a couple of things. There can be just probably a laundry list of things that fall into this kind of systems thinking approach. But one example is your EHR. Perhaps there aren't alerts that are turned on in your EHR that could help rise the information up to the provider or the care team's awareness to do something about it. You could have inconsistent or different workflows across your clinic sites where you've defined a process that you've spent a lot of time on, but you're recognizing that that process has not translated over to other care teams across the organization. We also know that MCOs are terrible at sharing timely information, and the care gap files are often either incomplete or they have inaccurate information or missing information that you cannot take action on. And then the last thing that I would say is systemic is really a clear lack of ownership of the care gap workflow process, as well as who is accountable for that within your health center to ensure that there is a overall kind of systems approach to addressing this particular issue. So these are all things that kind of occur within the confines of a health center that really do take a broader team to think through. This can't happen in a vacuum by one person because it interacts with so many different parts of your health center. And we'll talk a little bit about some strategies there. For the patient level barriers, again, we kind of touched on this before, but as you all know, health center patients have transportation challenges. And we know that the MCO transportation benefit doesn't work that great for health centers. And so access is a big issue. We also know that patients, whether they're established with you or on a MCO roster, their contact information changes very often due to various different considerations that they have within their lives and that they're facing from a financial standpoint. And so the patients that you all serve are harder to get in contact with. We also know that there are cultural and health literacy barriers for patients to understand like why do I need to come in for a particular visit, or there's hesitancy around vaccinations, or there is just a misunderstanding of how the healthcare system can help keep them healthy from a engagement and proactive standpoint. And so there are lots of different reasons why this work is hard. I think we all know that working within a health center and supporting patients that come to a health center is challenging in and of itself. But we do need to be mindful of these barriers, whether they are systemic, things that we can control to some degree around how we put our workflows and teams in place, knowing that there are already so many barriers that patients that you serve are facing on a day-to-day basis. And so a strategy that helps you really look at the systemic approach or the systems thinking for your health center is going to really orient your health center in a way that even with these patient level barriers, if you are able to get that patient in and see a provider, you can get those care gaps closed. The patient can get the care that they need in a timely fashion with the right operating model. So this next slide, we're going to kind of break down what the common care gap closure approaches that I've seen in my work. And I would love, if there's something missing, I'm going to run through these. I would love for you to throw them in the chat if something I'm not covering is coming top of mind. So the first one I think is the obvious. When you have a patient right in front of you at the visit, you know what the care gap is, and you are able to address it at that particular visit. So the patient's there, you address it, and you check that box. Pretty straightforward. Next, an approach for care gap outreach is reaching out to patients in between visits. So particular patients who are overdue for care, just generally. So I think of this as like, working a particular roster from an NCO, or just checking in with them in between visits and to ensure that they understand that they are due for another visit to help address whatever care gap is open. Next is more of a campaign-specific care gap strategy. So I know a lot of you do this, like I think it is Hypertension Awareness Month. So there may be campaigns going on at your health centers for patients who have hypertension that need to come in for a visit with their primary care physician to help support the management of their hypertension. We see this a lot in October around mammograms and Breast Cancer Awareness Month. In the summer months, we see this a lot with well child visits and doing an outreach there. So before school starts, parents can get their children in for well child visits. So that is kind of that campaign-specific outreach. And then number 4 really gets to the crux of managed care and having patients who are attributed to your health center. So they have not yet established care with your health center, but they are likely not receiving primary care anywhere else. And so this is doing an outreach campaign to those particular patients who essentially are either new to your health center. So this outreach would look a lot different than a patient who is established. Or alternatively, you could have patients who you haven't seen maybe in 2 years, and they are kind of in need for regular primary care. And so that is the 4th option. And then the 5th kind of care gap approach, this is more the administrative. So this is the data aspect. And I would say the very unglamorous part of care gap closure. And this is really kind of that, actually we're pretty much in that season right now with the managed care plans reaching out to you and asking you for either flat files or chart audits or chart reviews to see if particular care gaps have been closed. And so this is where perhaps a service has been conducted. So perhaps a cervical cancer screening did take place, but for whatever reason, that did not go over onto the claim completely. And so this is kind of the administrative kind of red tape, if you will, around making sure that the data is kind of backing up the service that was provided to ensure that the payer has that information for you. So these are kind of the common approaches that when you talk to a health center, really across the country, or if you talk to a primary care practice, these are kind of those areas where the strategies fall under. So for this next part of the session, I want to walk you through a bit of a framework that's going to help you think about how your health center is approaching care gaps currently, and gives you some ideas or strategies on how to either dig deeper into what you're doing, or perhaps if you don't have a strategy that you've spent a lot of time around, this can really be your guide on what to do if you're starting to think about this a bit more seriously in your health center. So we are going to talk a little bit about these key areas, and you may recognize this from this framework from previous sessions. This, I feel like, is a good framework that can apply to really any kind of process improvement, quality improvement, or strategy that you're wanting to start at your health center. So first, you want to get the leadership team on board. This may be some of you all, or it may not be, but this is the group that is going to really help enable this strategy to take place at your health center and remove barriers from the strategy to be implemented in a cohesive way. Next, we're going to assess your current state. So we're going to look at what you're currently doing around care gap closure and dig pretty deep, and we'll talk about that in a moment. After you assess your current state, you're going to have a kind of a clear lay of the land of what you're doing really well and where your opportunities are. And so with that, you're going to start nailing down what your priorities are in terms of care gaps and setting your clear objectives on what you hope to achieve based off of what you identified in your assessment. After that, you're going to start looking at key performance indicators. So what goal do you want to set related to care gap closure? How are you going to get there? What is your goal going to entail, and how fast are you going to achieve that? Next is, how are you going to do it? So we had briefly mentioned kind of those 4 different care gap strategy efforts on the previous slide, and we'll talk a little bit about how your strategy and action plan can encapsulate some of those based off of where your health center is and what available resources and tools you have. And then last, as a part of the framework, is that as you all know, process improvement really never stops. And so this particular step focuses in on making sure that you don't lose sight of this process, and that you are still receiving the intended outcomes of your workflow, and you're seeing those gaps in care close to the point that you would expect based off of your action plan that you have set up. Part of this is also ensuring that this spreads across the culture and that teams are trained appropriately to understand like what is required of them to be successful in implementing this particular plan. So let's go a little bit deeper here. We're going to go slide by slide essentially on each one of these areas. And I'm going to talk a little bit about how to think about this particular framework and how it can apply to care gaps in your health center. So engaging leadership, I think this sounds like very duh, if you will. But I found in my experience that there are times when health center leadership isn't always understanding or in the meetings that get to the level of detail that realize that there might be a need for time, space, and energy around a particular process improvement activity. And so some of this work it may require you to change, EHR templates or utilize staff in a different way. And so you need buy-in from your leadership team to ensure that you have those kind of constraints lifted and you have their support to move forward with this program. You also need a champion. You don't necessarily need to have your champion be the CEO or the COO. This is often, usually a QI director or someone else that is really close with kind of workflow optimization. But the goal of identifying a champion is that you want to have ownership of this particular process. And you want to make sure that that particular champion can influence through either authority or through their relationships, the changes that need to take place. And so if you think about this, and I've been in a situation where I've been asked to change a particular clinical workflow when I was the QI director. I did not have any authority over the EHR or how providers engaged with kind of how they roomed their patients. And so that particular process improvement project, even though I was a champion, it did not go great because I did not have the authority to make decisions that could influence the things that we needed to. And so we had to kind of rethink who was going to be the lead there in order to move our initiative forward. And then next, I know health centers vary in size and staff and availability and capacity, but this is hard work to do on your own. And if you think about all the areas that this could potentially touch, from a patient calling in from an appointment and talking to your front desk staff to the actual preparing for the visit occurring, and then any follow-up afterwards. This touches a broad group of your health center's team. And so you want to think about having those different perspectives engaged in this process because you as the champion may not have insight into all of those particular roles. And you also want to make sure that those who this process will impact have a say in how it is implemented and how it is shaped for buy-in purposes. So it's important to get your leadership on board so they clearly understand what you're trying to achieve here. Identify your champion who can influence the process and implementation. And then have a team around you that is cross-functional and that is like really in the weeds on how this would be implemented because it would impact their day-to-day workflow. So next, I think I could have probably had 3 slides on assessing your current state. But really you need to see where you're at. I think many of you probably have a good sense of, okay, we're addressing, we're focusing on well child visits for our care gap outreach, or, we're focusing on diabetes, hypertension, and maybe an annual wellness visit. But the idea of this is to really sit down and think through what happens for a particular patient in the areas around care gap closure. And so when a patient comes in and they have a care gap, what happens at that visit? How do they know a care gap is there? Do they know a care gap is there? What happens between visits? If a care gap pops up, is there communication with that patient? What does the care team do, or the data team that might help support the information that identifies that there's a care gap? What happens with patients who you've never seen? Do you reach out to them using MCO information through the rosters? Do you provide campaigns? Like I said earlier, do you have different focus areas based off of like season or month where it makes sense to do some outreach? And then do you do anything around administrative closure? So when the NCOs reach out to you, do you just delete the email, which I have been guilty of in a previous life, or do you work with them to provide them the information that they need? So kind of think about kind of those care gap closure areas and try to think deeply around what that looks like across your organization. You may come across that it looks different by site. That is not uncommon, but that is a finding in itself that you need to be aware of as you start to think about what this looks like across your organization, as well as moving towards a more standardized process that works for kind of that systems-based approach. So you kind of like, you can even do a process map here, but this is really kind of getting deep and probably talking with multiple different people to understand kind of how this is being approached at your health center. Next, we want to start thinking about not the people, but what are the support processes or technology that you have in your health center that helps with this work. So I think about Azara Drives. You can see information for patients who may have an open care gap. Even if, MCO data is not in there, you can use Azara Drives for kind of your entire patient population. So that is a tool at your disposal. For MCO only patients, you have obviously MCO reports that are coming in that can help drive that. But other strategies to think about that we're trying to understand here are, does your health center conduct a training around like proactive care planning? Do you understand who those patients are, what their care gaps are before they come in? Do you conduct daily huddles where your care teams look at the schedule for the day and identify who has open care gaps? Do you use the pre-visit planning report within Azara Drives to help set you up for success? So the idea under reviewing strategies to support processes for care gaps is to look at your EHR, how you're using Azara Drives, how you're using your team, who has what roles, to see how that is either helping you address this particular issue, or if there are areas of opportunity based off of what you see there. And then the next thing that I want to also talk about is maybe some different strategies at your health center that could alleviate that gap right when the patient comes in. And so this could be point of care lab testing for some particular measures that might help address that gap. If you have an on-site retinal scanning option, that obviously would help with the diabetic eye exam measure. So there's other kind of clinical tools, Cologuard, other different things like that where there may be a clinical gap, but there are some things to help you streamline that within your health center. So that is also part of the assessment. And then next, I think, you're doing this from kind of a team-based approach. You're really looking under the hood here from kind of how you all understand your care planning or your proactive care gap process. But nothing really replaces kind of looking at the charts and seeing, like taking a small sample. So I've linked here a process just looking at kind of 10 patients, not a huge population, but looking at 10 places or 10 patients and maybe identifying a particular care gap or two and looking at their charts and identifying whether or not that care gap was addressed at that particular visit or not. And that assessment is going to help you identify perhaps different root causes where you could not really see them in your assessment that you conducted with the team. And so getting into the chart, identifying that where the missed opportunity was, is just more data to help you really understand where the potential gaps are, as well as like what is going really well, because you may pull charts and you're identifying that 90% of them had an open care gap and it was addressed at that visit. And so you're also going to see what is working really well for your health center. And so then that could be an area to further expand upon if you find gaps in other areas. Also, it could show you that there is a lot of variation, perhaps between providers, between care teams, between different clinic sites. And so that's going to give you a really good kind of foundation for understanding what your current state looks like. Because next you're going to want to take all of that data through kind of mapping out your process, sitting down with your care team, identifying what is happening currently, doing that chart review. You're going to take the findings of that and you are going to start developing your strategy for improvement. And so that's going to take us to your priorities. And so there are so many different measures. There are so many different evidence-based guidelines that you could focus on. You as a health center need to figure out what is the most meaningful to your population that you serve, where the biggest gaps and opportunities are, where you're seeing some of the kind of biggest deficits in terms of maybe screening rates that patients need, especially maybe within your community or part of the state. You can also look at your managed care agreements and identify kind of where those high yield measures are. For Medicaid, often we see well child visits. And so maybe that is a priority for your health center because well child visits enable so many other care gaps to be closed as well. So you get a lot of bang for your buck, so to speak. But the idea here is to start somewhere and you can expand after you kind of start small, but you definitely want to identify that high need area that means something to your patients, means something to their health outcomes, and is also a priority for perhaps some of your value-based incentives through the NCOs. So from here, we're going to set some SMART goals. So I'm not going to belabor this, but let's say well child is where you want to start. You want to say, what are we going to improve? We want to improve the well child visit rate. And maybe it's at 50% now, and you want it to be at 60%. So you want to know where you're starting, and you want to know where you want to go. This is achievable because the things that you're going to put into place, and we'll talk about that in a moment. We're not going to say we're going from 50% to 100% because we all know that's not achievable. But we all know there are areas of opportunity for well child visits. Why is this relevant? I mentioned earlier, well child visits are kind of that gateway to wellness and prevention. They do a lot of different things from proactive identification of different issues that may come up, but also just from a preventative standpoint of immunizations, anticipatory guidance, and I think from a patient engagement and understanding, it really sets the stage for helping the parent and the child understand that this type of interaction with the health center and their provider is something that is that they need to engage in kind of along their life continuum. And so it helps set the stage for being more proactive around the care that they're receiving. And then, like any SMART goal, when do you want to have that achieved by? So you start at 50%, you want it to get to 60. How long will it take you to get there? So again, I'm not teaching you anything you haven't done before, but there is a lot of literature on SMART goals. And so I think it is always a good strategy to employ because it has all of the things laid out very clearly on how you're going to move that needle forward. So now let's talk about the plan. So we had talked about at the beginning these kind of five different care gap opportunity areas. And so I will share an example here in a moment, and they picked multiple of these different approaches for their population, but you could pick one to start. So for example, let's say you have your well child goal. You want to improve that. You are going to, let's say your strategy is to conduct a gap specific campaign. So you're going to outreach to all of your patients who are in need of a well child exam. So that would be a strategy for that particular measure. There are other ways to engage in this that would help you as well. So let's say you have a patient in, you're seeing them for a well child exam. Perhaps before they leave, either the MA or perhaps it is when they're checking out, they are scheduling them for their next well child exam. Again, I know each health center approaches their schedule in different ways. If they are, younger kiddos, that might be easier to achieve because they need so many within a time frame. If you're looking at the older kids, your schedule may not be open for the next year. So take some of those things into account, but know that there are different ways to approach your particular care gap goal that fall into these different areas. So you're going to select your approach depending on what that particular care gap is and how that aligns with the findings that you conducted in your assessment or what came up in your chart audits. And then next, you may find that, okay, we're doing okay. We are just going to essentially just make some tweaks to our current workflow because we found some issues within the chart audits that really pointed to, why these weren't getting scheduled. And then in other cases, you may not have anything in place to address that care gap. And so you may be creating a brand new workflow. So keep that in mind as you're selecting your particular care gap of focus and your strategy to help impact that particular care gap. So depending on where you're at, you could just maybe need to redesign, make some tweaks, or try a different approach, or you may be starting completely from scratch. Either way, it's okay. You, at this point, are armed with your assessment information, your very aware of that chart audit process. You know where you need to go. And from here, you just need to either redesign or create that new workflow. So next is kind of moving into that monitoring and improving. Going from your strategy to implementing to improving. I don't feel like 2 slides really kind of do it justice. As you all know, when you implement a new workflow or any change to your clinics, it takes a long time. And it's not always that quick. There's a lot of iteration, and that's okay. You want to learn and you want to move on and you want to make modifications based off of how you are learning. So we all know PDSA is a great framework to start from, where you are moving really quickly. You are kind of identifying a smaller group. Maybe you're starting this with one provider, you're testing it, and you are evolving it based off of what you learn there. And then from there, what you learn, you then spread. So again, we don't want to make just huge, ginormous changes. We want to make sure we're testing, we're monitoring, and we're making adjustments based off of what we learn through the PDSA cycle. After you feel like you have your workflow nailed down through however many iterations of PDSAs you need to do, you're still going to keep an eye on things, right? Because we want to make sure that the process doesn't break down after it has been fully implemented. So again, after you have implemented this across your health center, you want to periodically look at different, perhaps a 10 chart audit again, and get feedback from the teams that are engaged in this new process. Because as we all know, people change, staff change, and so there is always a time for processes to break down, just due to how our organizations are kind of living, breathing creatures. And so the champion and that team will be responsible for checking back in periodically to ensure that that new care gap process is still being implemented as intended, and you are receiving those results that you would expect based off of the workflow that was implemented. And then you want to start really instilling it into the culture and the fabric of your organization. So what does that mean? That means you have developed actual kind of documents that help support every person that is involved in that process, so they know what to expect and what their role is. You want to train the staff, and you want that to be a part of just kind of ongoing training as new team members come on board, depending on how they interact with that particular process and their role. You also want to formalize it into your QI plan. I think this would fit nicely into a QI plan for, I think, obvious reasons. But once it is there, that kind of establishes the core workflow to monitor from a QI perspective, and it has it on the radar, not only to the teams that are involved, but also leadership and perhaps your board of directors, who is, or your quality committee that is looking at QI on kind of a quarterly basis from a government standpoint. And then the last thing I think I would say around kind of really implementing this into your culture is how do you make this more visible to your care teams and those that are involved in this process? So are you talking about it daily? Do they know why you're now asking them to do a morning huddle, or why one of the care team members is pulling the pre-visit planning report to identify the patients who have an open care gap that need to be addressed that day? Like, do they know why they're doing that? And do you have a way to show the progress that care teams are making? Is there a way to gamify it? Do you have a, kind of dashboard or bulletin board at your health center where you can see how many care teams are kind of checking away at closing care gaps? Do you have a way to recognize or even maybe have incentives around this particular process? I've seen where a health center, if they met a certain care gap closure, they received a certain number of PTO hours. And so there are ways outside of incentives and bonuses to help kind of recognize care teams that are really working to implement this new workflow and make it fun for your health centers as well. So on this, I want to kind of wrap up here by talking about an example of a health center that I had worked with. And so they have used essentially kind of 3 different approaches that I'm going to run through. One, they really prioritized when the patient was in front of them, closing the care gaps there. They also had a proactive campaign. So again, reaching out on certain points in time around certain disease states. And then I don't know if anyone can really get away with this, but they had that administrative feature for care gap closure around documentation. So for the kind of the care gap closure at point of care, their goal was to, when the patient is there, we're going to address it when they are there in front of us. And so this health center used Azara, and on a day-to-day basis, they pulled the PVP or the pre-visit planning report for each patient that was being seen. And they worked in care teams. And so their care coordinator, who would work with 4 to 5 different providers, they would be the ones that would be pulling this and highlighting essentially what needed to be addressed from a care gap standpoint for that day when that patient came in. And then that care coordinator essentially distributed those to each MA, and the MA had a very important role in this process. So during rooming, they are, reviewing this list. They're confirming within the EHR that they are missing services because, as you all know, there are issues with data sometimes, and so you do want to confirm that. And then that MA flags it for the provider to say, hey, this is actually a care gap. It needs to be addressed. And so then the providers had the following kind of actions. They either did it themselves, so cervical cancer screening they could do right then. If it was something that they couldn't do, they would essentially make an order for that to take place at an external site or whatever that service was needed. Or if it was something they could not perform that day, I gave an example for a cervical cancer screening. If you're not set up for that, that might be hard to do that day. Then you would schedule a follow-up to get that done. But ideally, you would want to make sure you could get whatever it is that you needed done when that patient was there. Second, they did a lot of proactive outreach. So their goal was to target specific patients due for very certain services and bring them in. So again, their care coordinators were really the ones that were using Azara and identifying where those care gaps were. So if they were focusing on mammograms first, they were going to focus that reporting there. And then again, they had a team to kind of validate that to make sure that, a mammogram like test result wasn't just kind of hiding in the EHR somewhere and it just wasn't recorded properly. And so again, we want to make sure that that is being done. But after that data scrub is done, they would then reach out, get the patient scheduled for a visit. They would also really utilize other ways of communications, either through kind of a text outreach campaign. Sometimes EHRs have that capability. And then they would also offer to order that particular test for them. So then they could go and have that completed. Or if there were multiple things that needed to be addressed, they would ask them to come in for a visit. And then the last area is, again, this is the documentation piece. And so and you hear from MCOs on this, but how are they kind of addressing those things that was like care was rendered, but for whatever reason, it didn't show up in a claim, or it's not in a field that the health plan is aware of. And so essentially that team would take those care gap reports, and staff will check the EHRs to make sure it's there or not there. If the service was done, there are various different ways. This particular health center had the option to update that in the MCO's portal, and so they chose to do it that way. There are numerous ways to conduct that. But if for some reason that is truly a gap, the care was not delivered, then they will outreach to that patient to help get them in for the visit. So that is kind of the three different ways, again, approaches that this particular health center did related to care gap closure. They decided to do more of a systemic approach. So using Azara Drives, PVP, Pre-Visit Planner, any care gap that they could address, they were highlighting and they were trying to address it then and there. We all know that patients come in with their own agenda sometime. And so sometimes that's more of an art than a science to complete those things. And we just kind of sometimes have to roll with it. But their goal, which they were successful at, was to implement systemic change so that no matter what care team, what care gap, they had a process that enabled them to see the care gap when the patient was there in front of them and try to address it at the best opportunity. So this time always goes a lot faster than I think. We have a couple of minutes and I would just love to hear, I see we have something in the chat. If there's anything that pops up from a issue or barrier standpoint, you can throw it in the chat. We also have a survey that we would want you to complete as well. And that is what I think Terry put in there. And so just to wrap up, I hope today you take a couple of things. If your health center is still kind of working through this, no, it's not a individual person issue. This is a systemic kind of systems-based issue that your health center really needs to kind of wrap your arms around. It's data-driven. You have great tools at your disposal, but we all know that there are, gaps within the tools, within your EHR, within payer reports, but it's important to consider those. You need to have accountability. You need an owner for this. You need to have your leadership buy-in. And then the work really never ends. For the QI folks on the call, you know this. It's a constant process. You're reiterating, or you're iterating, you're refining, and that is part of the journey. So with that, thank you all for joining. Terry, I'll hand it back over to you. And if you have any questions, feel free to reach out.
Thank you, Heidi. This is really good information and appreciate you sharing it with us. I did want to remind everyone that this is the last session in this 7-session series. We are starting a new coding for value-based care series March 5th. So please check our website for details on how to get signed up to attend those. Thank you all for joining today, and I hope you have a great rest of your day.